Our next speaker is actually in Germany. He's a professor for medicine, Professor Dr. Jorgos Kavouras. So he's going to be accessed via the Zoom. So you guys, we're running a little bit late, but he's a physician in practice in a town called Pütterdorf, full-time. He's participated in countless lectures, congresses, and seminars in 15 different countries. He's called kind of a bridge builder between the mainstream and energetic biological integrated medicine. His personal goal has been to move modern medicine into a more humane and biologically more successful direction with an emphasis on this bioenergetic function of our bodies. So he works to bring integrative, orgonomic, homeopathic, and biological medicines to both universities and mainstream medicine. So he first came in contact with the Accumulator in 1975 and has been working with them and the Dor-Buster ever since. He was trained in the United States as a psychiatric organ therapist. He's been licensed in Germany since 1984. He's owned his own clinic also since 1988. His publication, which is in German, is called Heilen mit Orgonenergie, is out in the foyer area. I went to medical school in Germany, so I read German, but he has not had a copy yet in English. But it's somewhat of a case, it's a book compiling some of his case reports of 45 patients. He's also been the director of a homeopathic education at the International Academy of Classical Homeopathy, along with George Vitokoulos. If anybody knows homeopathy, he's a pretty important teacher in that field as well, very important even. And so he's been on faculty for integrative and homeopathic medicine at the University of Medicine in Timisoara, Romania. I myself visited Jorgos's practice many years ago, and I remember when I came in, I sat in the waiting room. People started talking to me, and I felt like I had come to sort of almost like a religious revival or something, because everybody was telling me, "Oh, he cured me. Oh, and he cured that, and nobody could do it." And I was like, one after the other, and I'm like, "Wow, don't worry about it. That's impressive." And that was just his patient population. Mostly at the time was orthopedic injuries that he was treating. In other words, people's bad knees, bad hips. And he has been working very actively with the accumulators all these years. If he probably had a scribe or somebody in his office, he'd be probably publishing many, many more articles. As it is, he was incredibly busy. And I know there's a great demand on his time just for treatments of all kinds. And unfortunately, he couldn't travel for our conference today. So he's trying to do it from Bavaria.
Bay Area?
I'm sorry? Part of Germany. It's yeah, and he they are also 9 hours ahead of us, just so people understand. Unfortunately, he won't be able to see the entire conference as a consequence.
Still hear me? Okay. So what's going on? You're gonna listen to me?
Yes.
You can hear me, can see me? Give me a sign.
Yes.
Yes, okay. Thank you. You're welcome. It's a little bit difficult. Sometimes the tone signal is not so good, but we hope. Thank you first for inviting me, and thank you very much to Connie and Stefan for the tremendous work they have done in order to bring such a conference together. Because I know what kind of work this is. I'm doing 2 congresses per year here in Bamberg in Germany, and it's so much work, and I cannot thank you enough for this and all the staff who's doing this work. It seems very simple, but many people are working for months to bring this together. So thank you very much, Connie, and thank you very much, Stefan. So, yes, I have been in contact with Wilhelm Reich since I was 17, I think. And as you said correctly, I built my first Orgone accumulator in 1975. So I was not aware that it's 50 years this year. So it's 50 years anniversary. So I have to celebrate this. And at that time, of course, it was quite crazy to have that in in my student's apartment at that time. But from the first day on, I tried to treat people which they said, "Oh, I'm interested. I want to do something about my health." So I tried from the first day, and actually, um, this the this was me making study medicine. So in 76, I studied medicine. So I first found the accumulator, and then I found the subject of medicine. And uh, all the years till I was a physician, I was working secretly. And in 1984, I was physician and had my approbation. And then I had the normal training as a physician in some clinics, but I never left the idea of introducing Reich into the medical world someday. And when I had my own clinic back in 1986, yeah, it was 1986. So it's almost 40 years. I always had an accumulator in the cellar, in the basement of my clinic. And from time to time, uh, I brought a patient down in the basement when I had the feeling that this would be something for treating with orgone energy. And it was funny because one of my first significant patients, she was one who she had a kidney hemorrhage, and I told her, and she was going to the clinic with the hemorrhage, and then she came back from the hospital. I mean, from the hospital, and there was nothing done. She was still bleeding, and the professor said, "There, I cannot do anything for you." So in despair, she came back to me and she said, "Can you do anything for this bleeding?" And then I knew, of course, Reich's work, the organ accumulator, its medical use. And it said, "No, don't treat bleedings." So I said to myself, "No, I cannot treat this." But then I said, maybe if I'm very careful, I can try, because if you don't try, you cannot learn. And I tried very, very careful. And she had hypertension at the same time. So I said to myself, oh, she has two contraindications for using the accumulator. But I tried very short times, like 3 minutes, 4 minutes, 5 minutes. We measured the BP before and in the middle and afterwards. And to my surprising, it was that the blood pressure came down. So with every session she was going in, she was starting with 200, she was going systolic, and she was going down to 160. Was a big surprise for me. And I said, oh my God, this is good. This seems to be good. So it seems that her organism has benefits the accumulator. And in no time, so after 3, 4 sessions, we extended the sessions very slowly from 5 to 10 minutes to 12 minutes. The bleeding stopped. So what has not happened 2 weeks in hospital, the accumulator could do it. And not only that, they couldn't bring down the blood pressure. The accumulator brought down the blood pressure, and we could reduce blood pressure medication. So, of course, you understand, this kind of experience encouraged me a lot. So I said, my God, you have to be very careful, but there is something in this accumulator which has a very strong healing capacity. So still, I told the patient, don't tell anybody, because, I'm in Bavaria, which is it's like Texas in the US. It's a very conservative, and they bring me they make it a law court, because I bring people inside a wooden cast and treat them. They either think I'm crazy, or they say I do something which is not allowed. So I told the patient, don't tell anybody. So the first patients I treated only if they would not tell anybody else. To my surprise again, whatever I had a good plan and treated it, it was working out. So this was amazing for me. And I want to tell you a case story of a man uh, who he had a basalioma. You know what a basalioma is? It's a semi-malignant tumor, mostly in the face, which, oops, yes, which is not metastasizing, but which comes again and again. So this guy was 51-year-old. He came to my clinic with chronic fatigue, strong depression, severe exhaustion. And this case was unique because he had been having surgery 15 times for basalioma. So it was removed 14 times and 15 times and 14 times came back again. And what was for him the striking thing was that from surgery to surgery, he felt more weak. It does if you take part of his energy away. So for considerable time, he could not go to his work, and the weakness was so strong that he could not go anymore to his garden. He was a very passionate gardener. He had not the power to move outside of the house and go to the garden. Everything is okay? Yes. The picture is frozen? Oh, it's okay. Ah, okay. I just continue. Can you hear me? That's good. That's fine. Yes. Very good. So he could not go anymore to his garden, and this made him depression. No, could not go to work, could not go to garden, 51 years old. So he finally came to me, and when I made a physical exam, I could not see any significant physical problem. But if you are familiar with Reich and an energetic approach, his energy field was very, very weak, was one of the most weak I have seen. So my medical advice was to sit into the accumulator for about 30 minutes. It's a 7-fold accumulator. I still run this accumulator. It's now 50 years old, this accumulator, and still works very well. I have now several, but this is the oldest one and is still working. So directly after the first session, he felt refreshed. After 4 sessions of 30 minutes, he could go back to his garden again. And after 10 sessions in the accumulator, he felt physically and emotionally so well as he has not been feeling for years. Isn't that amazing? So I was puzzled again. I said to myself, wow, I did not expect after 4 sessions he could go back in this garden. After 10 sessions, he was almost normal again. So I can only agree to what Michael said before, that these examples, and I have alone in my book are gathered 45. Now I have a second edition, is with 50 case examples. So this accumulator, and when you see later the Dor-Buster, they have to get their proper role in medicine because they are so valuable helpers in whatever therapy you do. In the meanwhile, because I have a professorship for integrative medicine, I combine the accumulator with all kinds of other complementary therapies, also with the ordinary medical school treatment. And there is so good combination. There is no combination except the few examples Reich already gave. Except this, it's a fantastic combination. And I myself, because I'm a passionate homeopath, and I have been teaching homeopathy in 15 countries already, I love to combine it with homeopathy. It works very well together. So let me just give you a second example. Now we are talking about a woman who she was 60 years old when she came, Her primary sickness was a bronchial carcinoma, which she had surgery 2 years before. When in the very year when she came to my clinic, she had a tumor of the right kidney, which showed and some local metastasis, and they couldn't find out whether there was a connection to the first tumor, yes or not. For our understanding of biopathy, it is not the major role, because once you have the cancer biopathy, it can spread to everywhere in the organism. You can have a second carcinoma, you can have a metastasis. The biophysical background is similar. So they could not remove the kidney because the metastases were grown around the big vessels of on the aorta and the vena cava inferior, were grown around by the tumor, so they couldn't remove they made only a palliative surgery. And after this surgery, she was very, very weak. They call it now tumor fatigue syndrome, because that happens more often than one time. So because of the remaining tumor masses, she had 3 cycles of high-dose chemotherapy, each lasting 3 days, with an interval of 1 month. They were proposed. So between the first and second cycle, she was so much worse that she spent the largest part of the day she spent in her bed, had no appetite, and lost steadily weight. The second cycle had to be stopped after the first day, so she could not continue the first cycle because they thought she might die through the treatment. So her state was so serious now that she could lie only in bed, lost further weight, and in the middle of October she had the feeling that she would not be alive on Christmas, which I think was quite realistic. So her daughter has learned about the accumulator and my clinic, although I did not allow anybody to speak. You know, the whispering is sometimes even stronger. So she finally came to my clinic, the daughter, and she bought a bonus card of 10 organ accumulator sessions because she has read that the accumulator would give strength to an organism, and she thought maybe this helps my mother. So now her mother came, and she was been treated with the accumulator, and she was doing better. Obviously, she was doing better. After 1 week and 3 sessions, she gained 4 kilograms of weight. It's unbelievable. Huh? After 3 sessions already, she gained 4. That means her appetite was much better. She could eat, and she gained weight. After 10 sessions, she was doing well, and she said, now I want to continue. I want to pay myself for this device. Because you remember, the first 10 sessions were paid by her daughter. Now she said, although she was a poor woman, she said, I want to pay myself. I didn't take a lot of money at that time. Still now, it's quite cheap. But anyhow, you have to pay. So she spent Christmas in very, very good condition, and she started in January the third cycle. The physicians and nurses which they saw her, they said, is this the same person? They could not believe. You understand? They have seen her, they had to stop the second cycle of chemotherapy. Now she came back and she was doing so much better. The female physician said to her, What have you done? What the hell you have done? In American. She said she was using an organ accumulator according to Wilhelm Reich. So the physician said, I don't think much of that, but if it's working so well, please continue to do this. It's very funny. Yeah? So she came through the third cycle of chemotherapy quite nicely, and And this is what we found out, what I found out later, that if you accompany chemotherapy with the accumulator, the side effects of the chemotherapy are much lessened. Even like in this case, she could go in the third cycle, which before was not possible for her. The metastasis, and I followed her for more than 1 year. She was in very good condition. The metastasis continued to go slowly back, and she was able to do her homework by herself. She for this whole year, she coming for the accumulator 1 time per week. And when she has some pain in the kidney area, she uses an Orgone pillow at her house, which takes away the pain immediately. So you see what these so important devices that Wilhelm Reich found can do for the people. And shall I move on? Give me a yes. Yes, give me your hands. Yes, thank you. Yeah, now you're giving me some energy back. I give you my energy, you give me your energy back. So, because we have to watch the time also, after some years treating mainly with the accumulator, I always was aware that there exists the Dor-Buster. And I said to myself, most probably the Dor-Buster is even more precious because in so many diseases we have an excess of Dor energy. Why not give organ accumulator to the organism and tear Dor energy out? So at that time, nobody here in Germany knew how to build the Dor-Buster, and I had to call several people in the US, and they gave me some idea how the Dor-Buster is constructed. At the end, I took the principle and constructed my own thing, and I had no idea whether this device would work, because it's a small accumulator where water flows through, and then I left the construction which Reich had used with the tubes because the tubes accumulated Dor too much and polluted the rooms. So I put funnels in front of the patient. This was the only considerable change. And still we use the funnels because the funnels are really much more practical. So the first patient, and then this device was ready. I had no idea how strong should be the water flow, how long the patient should sit in front of. I did not know anything. So the first patient, the very first patient that came was a craftsman. He's famous. He will go to orgonomic literature. He has already gone too. So he came with carpal tunnel syndrome. All of you know this is in the area of the wrist. It's like there is a stenosis there. The nerves which are going through are compressed, and energetically is a block. If you go with your hand over it, it's like a block, a strong block here, energetic block. And I said to myself, because his wife, always the women are the more wise, normally, his wife sent him to me. Maybe Kavouras can do anything. So I said, there's a block here. Maybe this is my first patient for doorbustering. And the carpenter syndrome, what he has done before, he has a house, he's a craftsman, and he dig one cellar underneath his house with his own hands. So he overstrained his hand very, very much. And when he came on a Thursday, he was scheduled for surgery on Tuesday, 5 days later. And on Thursday he came, and I had no idea. And I said, okay, you go to the Dor-Buster. And he went there, he saw the device, he said there's no electric, there's no instruments, there's only water and some funnel. And he was not believing that this could do anything. So till that, he could not sleep any night. The typical for carpal tunnel syndrome is that you cannot sleep in the night because it starts numbness in the night, it starts tingling in the night, you cannot find sleep. He could not sleep at all anymore. So I put him, and he was looking with very suspicious eye to the device, but said, okay, my wife said I should come, so I will stay for the 10 minutes. When I saw his eyes, I said, next day he will not come back. So next day he came and said to me, you know, doctor, I didn't believe in this device, but for the first night I could sleep. Can it has to do with this device? And I said, yes. I played now the connoisseur. Huh? I played as if I know. And I said, yes, of course it has. And he stayed for one more treatment. And on Monday already, this was the third treatment. It was so good that he could cancel surgery. That means after 3 sessions, this disease was already almost cured. He had to come for some more sessions because he overstrained again. But you see, God had sent me a very good patient because I found out later that carpal tunnel syndrome works in 98% of the cases. Even those cases which had surgery and had a relapse, because 15% of the surgery cases, they get a relapse. Even after relapse, they were cured with the Dor-Buster. So this was encouraging me, of course, a lot. And I want to give you one more case. I have so many, but yes. How am I with the time? I have some time, eh? Connie, I have some time, yes. So now, with the time I found, as Connie said correctly, we treated in the beginning, we treated mainly in the extremities because I was careful not to use the Dor-Buster in the brain segment. Later on, I used it, but for, let's say, almost 10 years, I was very careful using it only in extremities and with very, very good success. I can say whatever we tried worked. I cannot remember more than 1 or 2 cases where there was not working or not working good enough. So whenever nature has a possibility, I found later out, the Dor-Buster will give the organism a chance. So now there came a 44-year-old recreational athlete who, after a long sport break, was now preparing for triathlon. You understand triathlon, huh? Triathlon is a combination of swimming, running, and bicycling. So when he first time went for training, he did an insufficient warm-up or some overexertion. He had a sudden pain in the thigh. And when he came to me, he had a thumb big muscle fiber bundle rupture, an extended hematoma over all the thigh, and you could put one thumb. There was a defect in the thigh where you could put your one thumb inside. So normally, at the same time, a very famous football player from Bayern München, you know Bayern München, huh? It's a famous football club. He had the same injury at the same time. It took him 12 weeks to come back. So this one, he said to me, can you do something? I want to go for the triathlon 4 weeks later. I said, it's impossible, forget it. It takes at least 10 to 12 weeks. Maybe we can halve the time, but still you are not to go for a triathlon. You understand? Triathlon means it was a junior version for 1.5 hours, but still, imagine. So I gave him treatment So the triathlon which was planned was 500 meters swimming, 20 kilometers bicycle, and 5 kilometers of running. So the only treatment we did was homeopathy and Dor-Buster. So after, I don't remember exactly, I think we gave him three sessions Dor-Buster per week. And 1 week before they went, that means after 3 weeks, he said to me, now I will try. We have a trial competition. I will go. I said, you are crazy. I forbid. You don't go. He said, no, I feel my thigh is very good and I will go. So I left him. I said, it's okay. So he went for the trial competition, was about half of the distance. He had no problem. And 1 week later, also 4 weeks after the injury, he went and finished this junior triathlon without any complaints. Actually, for me, is still sensational. You remember the one from Bayern München, which has the same injury from a major football club in Germany, took 12 weeks to come back, and with the Dor-Buster after 4 weeks came back. It's unbelievable. But if I would not have seen, I would not believe. So I have so much to say, but let me talk a little bit for things. Before I give you another example, I want to tell you a little bit about what I am thinking after all these years. After all these years, I was thinking that Reich found an exceptional concept. The idea of energy being a very playing an important role in the mechanism of the human body. That means there's an energy which he called Orgone energy, which of course the Chinese and the Indian people they knew for thousands of years. Anyhow, he found it back, and especially he found a device which can accumulate this, and we can use it for daily use. And not only this, after Oranua experiment, which was one, in my opinion, and somebody's going to talk about it tomorrow, I think, from my opinion, is one of the most important experiments was ever done in human history. He found the Dor energy. And in order to depollute his area in Rangeley, Maine, Orgonon, he found the Dor-Buster. And the Dor-Buster is at least equal beneficial to the human organism than is the organ accumulator. And I said to myself, after all these years, after all this experience I have, the combination of the two devices is even more beneficial. You take the bad energy out, you put the good energy in, and then whatever nature can heal, it will be healed. And I remember, I remember so many cases, but this is a case I want to give to you because she was a woman which she had a, a rectum tumor, which was about, I think, I don't remember exactly, 8 or 10 centimeters from the anus. But she had several polyps, and one was malignant. And then she went to surgery and they put out the wrong one. So they cut out a piece of the intestine, they put out the wrong polyp, so they put out the benign, and when she go for examination, the malignant was still there. Now the problem was that the malignant now was so much closer to the anus due to the surgery that now there was not possible to make a surgery without artificial exit. And she was a woman, 45 years old, no partner. Having a colostoma all the time is very difficult to find a partner. And she refused surgery. She said, I don't want to have surgery. I rather die than have surgery. So she found herself in my clinic, and I said, you have to have, of course, I have to say to her legally, you have to have surgery, of course. She said, no, I sign that document. I don't want to have surgery with no means, and I still feel weak from the first surgery. So I said, okay, you sign me a contract, I said to her. You go to the accumulator, and then uh, after every 4 weeks, you go to the examination, and if the tumor is growing, you accept surgery. She said, okay, I signed the contract. So she was going, this at that time should be used only the accumulator. The Dor-Buster was not in function at that time. Now I would have treated, of course, simultaneously with the Dor-Buster. So after 4 weeks, she said, I feel much better. I look with confidence. I go to the gastroenterologist. He shall examine me. Now she went to the gastroenterologist, and he said to her, listen, if you don't do surgery, I will not examine you. It's like in kindergarten, huh? You say, he was, you understand? He said, I will not examine you. So I said she came back to me. I said, what can we do? We treated first, we continued treating her. I don't remember. She had maybe, I guess, 20 sessions in the accumulator. Now she felt so good that she said, now I feel courage to go to surgery. Okay. Now she went back to the same gastroenterologist. He examined her. He went into the intestine, the rectum. He examined her for 5 minutes, for 10 minutes, for 15 minutes. And he said, I know exactly the spot where the tumor has been, but it's gone. He said, I cannot believe, but the tumor has gone. So I want to show you this case. Of course, she was happy, huh? The tumor was gone. She didn't need any surgery anymore. And I could hardly believe myself. This was a case of a tumor in a very early stage. And you see what orgone energy can do. It was bringing back the tumor to normal tissue. For me, it was very, very unbelievable, and the patient, of course, was very, very happy. You can do some applause, but this applause is for Wilhelm Reich and not for me. Please give some applause. This is for Wilhelm, good old Wilhelm. He found this device. It's hardly to believe. So how many minutes do I have, Connie? Make me signs. 10 minutes, 5 minutes? 5 minutes, okay. Let's go. So, as I told you, for me, and I will talk again tomorrow. We'll come back a little bit tomorrow. Tomorrow I will talk about nature, because in my understanding and also in Reich's understanding, most probably, nature functions similar to our organism. So what I found out over all these years is then when you have a good plan of combining, nowadays, of course, I'm combining almost always, the accumulator with the Dor-Buster. We have seen tremendous results in burns. All of you know this. So that if I say, I have written in my book, if you treat a burn without the accumulator knowing about it, you make malpractice. It's a medical malpractice because the results are so good. So you see a healing in very short time. Most of the cases, there are no scars at all. Many times I combine with the Dor-Buster if it's a severe burn. So it's so obvious that we have so many times tried to make. I tried last time. I tried in Romania, but to make it research subject. But we had all there, but then there was a lack of money, and you understand we should have some money before we start the research. But it's a very easy research. The outcome is so clear that I put my hand in fire for that. So, in my belief, the whole idea of biopathy, the whole idea of orgone energy and door energy is so valid. So there's a misunderstanding, I think, even in some orgonomists. They think, or no, the ergonomists maybe not, but many people think, yes, but what is going to be with all the door energy? You remove the door energy, but then there will be too much door energy in this planet. Actually, this has taken case out of other reasons. But in the moment in the human organism you move door energy, it will change its character back to orgone energy. That means there is a circle in the organism of orgone to door energy. In every body, door energy is created every moment. But the healthy organism, which is pulsating, which is breathing, which is emotionally taking part in the world, it will remove in no time, it will bring back door to orgone energy. So there is a circle in the organism. And of course, when we treat sick people, we use that circle. I mean, we give more orgone energy, we clear out the door, and then the natural functioning is coming back. So it seems so simple, but as simple it seems, as good it works. I thank you very much for attention. Thank you very much.